Same with me, Guillem. Don't worry.
Good.
Okay, so I think we will start and we will continue to admit people into the webinar as we continue. So I'm just going to say a couple of words. Hello, everyone. Thank you very much for joining us today. Welcome to the first SPR webinar of the year as part of the SPR Distinguished Research Webinar Series. My name is Galit. Juan Cruz, who is also here, and I are members of the webinar organization team. We will be taking care of the tech support throughout the webinar, so please feel free to contact us via private messaging or emails. I will leave our emails in the chat in a few moments. We will also help address questions that we'll be taking at specific points during the webinar. Until then, feel free to leave your questions in the chat. The webinar is being recorded and it will be uploaded later to the SPR YouTube channel. So today we are welcoming Professor Guillem Feixas, who is a full professor at the Department of Clinical Psychology and Psychobiology at the University of Barcelona. His research is mainly focused on understanding self-identity and interpersonal constructing, as well as studying the role in health and psychotherapy. As part of his research, he developed an intervention targeting dilemmas often implicit in the client's meaning structure to increase the efficacy of therapies of different orientations. His research incorporates a different variety of methodologies, ranging from randomized control trials to narrative analysis. The title of today's presentation is Focusing Interventions on Self-Identity and Metacognitive Processes, a technology-enhanced proposal using virtual reality. So Professor Feixas, thank you for taking the time to present as part of our webinar series. Please begin whenever you are ready.
Thank you both, Galit and Juan Cruz. It's really a pleasure for me to be here. I remember my first conference in SPR. It was back in 1989. That is, I think, where I met Franz Kaspar. And I have been attending some of the conferences, not all of them, but I really feel much connected with the SPR community. And for me, it's really like being at home, and it's really a pleasure to be here and to be sharing with all of you what I have to say. Let's see if that is of interest to you. I'm going to share the screen. And yes, and I will keep it not in the presentation mode, so that for my convenience, sorry, because I can leave your images in the left part, so that I can work better with the slides. Okay, so if anything is very important to clarify, I don't mind having questions in the middle of the presentation, but if I remember to do so, I will stop at some points so that you can also have more time for that. Okay, so let's see. I want to stress the importance of self-identity, which is being increasingly recognized in the literature. I think it's something obvious. I mean, we all know that identity is central, but it is not so obvious in the theories and in the literature, in psychology in general and in psychotherapy in particular. I am not going to delve into the meaning of the idea of identity, but identity processes involve both differentiation from others and also assimilation to others. For example, if part of my identity is being a psychotherapy researcher, that is something that differentiates me from other people working in psychotherapy who don't care a lot about research, but also is making me belong to a nice group of people like you all, who really do care about psychotherapy research. So that is helping me to define myself as at least my professional identity. And many other aspects might be part of my identity, not only the professional one. But identity is also important for preserving the need for psychological continuity. In a context of constant change, this need is even increased. We need to have the sensation that I am the same I was 1 hour ago, 1 day ago, 1 week ago, 1 month ago, 1 year ago, 10 years ago, maybe more, right? But although it's not exactly the same, but I need to recognize that I am the same, the sameness of myself. In Spanish, there is a word for that, which is el reconocimiento de la mismidad. There is a word for that. In my view, this is quite a neglected topic in psychotherapy research basically for one reason. Both psychologists and psychotherapists, we are committed to producing change. This is part of our identity. We want to construe ourselves as change agents. And the need for continuity is exactly the opposite of change. Is a different need. So it is recognized somehow because it's not possible to discuss the importance of identity to disregard it easily. But at the same time, is not a central topic. Let's have a look at what a very simple bibliographic search is telling us. Is that the amount of publications using self-identity. I used only this term. I didn't make a systematic review here. It's just a very quick approach. And I only use self-identity to separate it from sovereign identity and other terms which have to do with things like identifying who are you in a bank account, right? So it's something that doesn't import to us, but self-identity, it does. And we can see that there is a constant growth, which also tell us that at the beginning, for decades, this was not a very central issue. So I think this is interesting. If we look for the word psychotherapy in a Scopus, we found a lot of documents. But if we add identity to this search, we only find 2.5% of documents of those employing the word psychotherapy. Only 2.5 employ the word identity. And if we look at the evolution of this, only one document in 1955, another one I think in 1958 or something like that, and in 2024 it's 224. Yeah. So it's quite an idea, an approximation to the lack of interest of the topic of identity in the area of psychotherapy, but also of the tendency, the trend that this topic is becoming more of interest for people in the psychotherapy area. So personal identity is so important that it couldn't be neglected, and it wasn't. It was approached from different perspectives in the history of psychotherapy. In psychoanalysis, from the initial model, including ego and superego and all that, the notion of identification, I think it's a great gift from psychoanalysis to all the psychological community. It's such a fantastic concept. And then more specific authors who focused on self, like Kohut, and also the Horowitz, two different people named Horowitz that were focusing on personal schemas, so schemas about the self, right? So in psychoanalysis, there has been some attention on that. In humanistic psychology, the word self is quite used, self-esteem, self-realization. We can find that in transactional analysis, the scripts, the self as a parent, as an adult, as a child, and all the dynamics. We cannot find it in behaviorism. I think they didn't care about identity until Bandura started to talk about self-efficacy. There is no self, it's only behaviors, right? So it's, maybe I'm wrong, sorry. And then when cognitive therapy arrived, basically identity was reflected in what they call core beliefs and schemas, which are often considered wrong, rigid, inflexible, irrational. And of course, we have a schema therapy, which is paying a lot of attention also to different parts of the self and different self positions. Okay, so schemas is part of the thing, and this is something much more dealt with in the psychotherapy area. It is well recognized that that self-schemas and personal goals govern distinctive patterns of thinking, feeling, and behaving. They are recognized as endured aspects, so difficult to change, and develop over time and interaction with people. And we would expect that many of our assessment tools should be helpful identifying these schemas, particularly the core structures, and map them. That would be reasonable to expect, given the importance. But self and identity are often seen as elusive and nebulous concepts. I am quoting some texts that say though explicitly. So there is no widely used method to map the cognitive system, including core and peripheral aspects of the cognitive structure or the schemas of the person. I am proposing here to have like the methodological advantages and also the epistemological advantages of personal construct theory. I am proposing to view schemas as personal constructs. The basic idea is that most of personality theories or theories about human functioning are based on theoretical constructs. So any theory about how human beings are made, for example, the Big Five theory, is based on theoretical constructs. For example, extroversion, introversion. That is a theoretical construct. The main claim of Kelly was that the people we are trying to help, they do also have a theory. And that theory is made of constructs. It's just that they are not our preferred theoretical constructs. They are their personal constructs, idiosyncratic, very specific, and made from their experience. Similarly to what a theorist does. And a researcher on personality studies people and creates the theories through experimentation and arrives to a model like the Big Five or the XACO or any other, or the Enneagram or any other model which is in fashion now. And it arrived at through experimentation. But human life is seen by George Kelly as experimentation. In every moment of our experience, this is an experiment because our constructs are being tested and maybe validated, maybe invalidated. And from that, change in our construct system can occur. So we can make some parallels to these schemas proposed by the Horowitz and Beck and the personal constructs except that for Kelly, constructs were basically bipolar in nature because they were like distinctions and they were meant to grasp a difference. Also, he mentioned that the most central or core constructs are what define a person's identity. So what is this thing of a construct? Because I'm giving some references here, but I would like you to do like an experiment, right? So I would like you to do an experiential exercise online. If you are ready for that, I only need you to have a piece of paper and a pencil or pen, or that you use like a Word document or something like that. I'm going to do the later. I'm gonna use a Word document. So let's see if I find it. Here it is. Okay, and what I want you to do is to write your name in the document or simply I or something like that. And then the name of two of your carers, your main carers. So in my case, Mama and Papa. Okay, you can write whatever names depending on your family configuration. You might write someone else, right? But I want you to write these three names in this piece of paper, as I did in mine. Is that all right with you? Yeah? Okay, great. So now I'm going to ask you to think of these three people, and not in terms of the gender, age, or if they wear glasses or not, or if they are tall or short, right? But in terms of their way of being or personality, okay? What we commonly say, character, personality, not being very precise on those terms, way of being, okay? And we think of these three people, and we try to, maybe you close your eyes to see it better. You think of these people, you have a sense of how they are, and then you notice two of these people who are more similar than the third member. Okay, so that you notice that two of them are quite similar, and then in something I could ask you this tomorrow and you would tell me something else. It's not important. It's just the first step. Okay, so don't take it very serious, and we can use like something to write. I think this. Okay, and I will connect myself with my mother. Okay, so yeah, okay, let's see. Okay, so I connect myself with my mother. Okay, it's not an emotional connection. It's like while looking at how these people is, according to your views, they look similar to you. Okay, so I in my view, I look similar to my mother. Okay, and now the next step, I hope you are already done with connecting these two people. And now I in my next step is that you could express like an adjective or an attribute that describes what do they people have in common? How do they are alike? For example, I would put daring or like yeah, I think daring is the good. If I would say it in Spanish, I would say atrevido or atrevida. Okay, maybe you can find a better English expression for that if someone can help me on that. But I would say that. Okay, so that is it dares to do things that maybe other people don't dare to do. Okay. And so you can write your own word. Of course, you don't need to. It would be a tremendous casualty that you find the same word. Okay, so this is only useful for me. And in your piece of paper, you have different people and you have a different adjective. Okay, it could be a small phrase like someone you can trust. That could be useful. Okay, someone you can trust. You don't need to say trustable or something like that. Something that comes to your mind as a similarity between these two people. That doesn't mean that my father was not daring. It means that daring was more salient for me and my mother than for my father. Okay, it could be that he was absolutely no daring at all, right? It could be, but it doesn't mean that he wasn't. It's simply that these two people are similar in being daring, right? Everybody has advanced on that? Is this okay? I'm seeing few people, but the few people I'm seeing, they seem to be doing well. Okay, thank you. So now I would like you. I'm going to erase all this because I am not the important person here. You are the important people, and now I'm going to ask 2 or 3 volunteers to tell me what is the word. I don't need to know the people, only the word that they wrote in their piece of paper. A volunteer, please. Are you doing it in the chat? Okay. Okay. I have two, introvert, expressive. Okay. One more is all right if one wants to use one more.
I wrote down ambitious.
Okay. Okay. And expressive. Okay. Great. Okay. So introvert was by Camelia. So now I would ask Camelia to think about, but not tell us, just think about and write in the piece of paper, but not tell us. I would ask Camelia to think of how would you describe, which adjective would you use to signal, to describe the opposite to introvert. So how is a person who is not introvert at all? And also for the person who said ambitious, I would ask her not to tell it, not to say it, just to write in her piece of paper what would be the opposite of being ambitious, right? And for Nicole, the same. What would be the opposite? And for all of you, in your piece of paper, to write what would be the opposite word for that. Okay. Okay. So now let me pick ambitious for a moment, just to make the exercise shorter. I will not do it in the three of them. So I would like to ask everybody except the person who gave me what's your name, by the way? The person who mentioned about ambitious.
Galit, it was me.
Oh, this is Galit. Okay, Galit. Okay, thank you, Galit. So now you shouldn't say anything. And I ask everybody else if they could say what would be for them an opposite of ambitious. What would be for them? What would be the opposite of ambitious? How would you describe someone who is not ambitious at all? Okay, timid. I see it. I'm writing it. Okay, more. I need more. Unambitious could be an option. Not ambitious, that would be valid. But unambitious, okay. Okay. Not ambitious, okay. Lazy, okay. Lazy. That's interesting. Passive, okay. Okay. Let me put one myself, okay. Okay. Right? Okay. So thank you for that. Let's stop here, okay? So now let's imagine you are in a therapy session, okay? And the client says, well, you see, my parents were very different. My mother was very, very ambitious, but my dad wasn't at all, okay? And we think we somehow understand what the client is telling to us, okay? Because these are common words in our dictionary, okay? But can you see the difference between saying that using one or the other adjectives as the opposite? By the way, Galit, can you tell us yours?
Mine was passive.
Passive. Okay. This is okay, but so if this was the word, this was the situation, and this was eventually elucubrating, Galit was in that situation and was saying that sentence, which I'm now inventing, of course, that would mean that her dad would be passive. But it would be different to if that would be timid or cooperative or lazy. she's telling something very different about her dad, depending on which is the construct. This is the construct. A construct is a distinction. It's not ambitious. It's not passive. It's the distinction between ambitious and passive. It's a very special distinctions, which is different from ambitious and lazy, or ambitious and cooperative, right? So but it not only changes the meaning for the father. Imagine ambitious versus cooperative. If she's saying that, it's changing the meaning for the mother, right? So it's a different meaning. If Galit says my mother is ambitious, my father is passive, that if she says my mother is ambitious, my father is cooperative, right? It's saying something very different, right? Because the construct is the grasping of a difference is a particular contrast. Is a contrast. A construct is a contrast. So let me delve a little bit more with you, Galit, just for us. I trust in your generosity. I can assume that Galit was not born with this construct in her mind. Okay, so it came with experience. Okay, so at some point in let's imagine everybody in her environment was ambitious. Okay, everybody, absolutely everybody. So it arrives a moment in her development where someone in the family points someone else, or she finds someone who is not like that. And then she realizes there is a difference. And then the construct is created. Before, everybody was ambitious, but she didn't know people were ambitious because there was no contrast. Let me put the example of a fish swimming in the deep sea. They never go out from the sea. They don't have a construct for water. I have interviewed a few, and they told me they don't have a construct for water. Okay? But when I interview a fish who jumped and went to the surface and get contact with the air, they did have a construct for water, because they could see that there was something that was not water, right? So it's the contrast that made the meaning. So thinking of water for a fish is meaningless, because everything she does, a deep sea fish, everything she does is in water. So it doesn't say anything at all, water, right? Even when it is so important, it doesn't say anything. So the idea of a construct is this idea of a difference. And in many philosophies, and also in biology, differentiation is the basic of life. So the growing of our meaning systems comes from drawing or capturing differences in our perceptions and creating the schemas out of these differences. So meaning creation comes from grasping differences. This is the idea. That's the reason why a construct is a particular type of a schema, if you want to call it that way, but it's based on the idea of difference embedded in it. And that's why it needs two poles, right? And that the tension between the two poles is approaching us to the meaning, right? So, of course, Galit doesn't have only one construct. She's got many more constructs, right? So, if I am not abusing you, I wouldn't like to. Can I ask you another question?
Of course.
Okay, how would you describe typically someone who is passive? How would you describe?
Someone who doesn't take action to make their dreams or goals come true.
Okay, this is a definition of that. But let me ask you, what a different way, what other attributes usually people who is passive do have? What other characteristics?
Maybe unmotivated,
Okay.
Uh,
Okay, that's good enough. Okay, so we have like in Galit system, we have like two constructs. One is ambitious passive, and the other is unmotivated, and someone else may be motivated. I am elucubrating now. And these two constructs seem to be a little bit connected, so that there is a high tendency that when Galit perceives someone as passive, she infers that that person is also unmotivated, right? So because constructs are not applied, the constructs that are applied to understand our interpersonal experience, but they are not applied absolutely independent. They are applied in a network of meaning. And we have now a little piece of the network of meaning of Galit's system, right? So that in her system, this is like that. They are associated. If our constructs were not associated, they would be very useless to make meaning, to derive meaning from the interpersonal situations. We make meaning of the situations by making inferences. And we make our inferences according to the structure or the connections that our constructs have among them. So we have many constructs, and these constructs are connected in a network, and this network is hierarchical, and this hierarchy of meanings suggests that, okay, I'm not finding the, suggests that that the core of the structure, the core of the system is our identity. So this network is related to our identity in this theory. And in this theory, one advantage is that we have a method, which is the repertory grid. It's not the only method. It would take us a while to talk about all the methods that personal construct therapy or theories have created, but this is one of them. It's not a test in the conventional sense, not a questionnaire, but it's designed to capture these constructs and how they are connected among them. It's an ideal instrument to assess subjective perception. So I am not claiming objectivity. I am not going with the repertory. I am not going to tell you the truth about the respondent. What is the respondent's true self or essence? But I am going to describe with you the respondent's subjective perceptions of self and others, using the respondent's own terms. And that is done using a structured interview. In that interview, we first select the people, as we did a few minutes before. I ask you to select yourself and two other people, but we would select maybe a dozen or 15 different people. And then I would be making questions like the ones I did to you to elicit the constructs. So what we did just a minute with Galit, Nicole, and other people, and all of you, was eliciting a construct. So we can elicit not only one construct, but many other constructs, comparing, for example, mother with father, or with you, with your sister, or whatever. Okay, so we can make comparison questions. And after we have the constructs and the elements, we can do a rating task. The main function of this task is to see how do you apply, how clients apply their constructs to themselves and to the other people in their lives who are relevant. So we can see the system operating in just one experiment. It's how they apply their constructs. So they are working at that moment and in using their constructs to rate people. And this is a very huge difference with questionnaires. In questionnaires, people answer about themselves, how I am. But here they have to define not only how they are, but how other people are, and also how the ideal self is. Let's look at this is a repertory grid, right? So, wow, this is the great instrument. This is nothing. It's nothing in it. I just added these two things in the last minute, but this is the strength of the repertory grid, that it is empty. So it's a collaborative task that you have to do with your client to elicit their meanings, not your preferred item questionnaires or characteristics like introversion, extroversion, and so on. For example, in this case, one of the meanings that she provided is bossy and quiet. Okay, and I wanted to mention this because in the rating task, she would rate people when they are very bossy, they will use a 1, and when they are not so bossy, they will use 2, a slightly bossy 3, middle point 4, and then a slightly quiet 5, quite quiet 6, or much quiet 7. So the left and the right grow from 1 to 7. Okay, so that's the basic system. Let's look how it worked with Elena. Elena was a 49-year-old woman from Puerto Rico, living for 25 years in Barcelona. She had remarried. She had a 30-year-old son from a previous relationship. She was very basic in her educational level, with difficulties for understanding simple statements such as the items of the questionnaire sometimes. But with the grid, she did very well. She worked as a care for older people, and she's now unemployed for 15 months and not very enthusiastic about returning to work. 2 years ago, that seemed to happen something important in her life with the onset of physical pain associated with osteoarthritis and fibromyalgia. Then, unable to continue with work, living only with her husband's pension. He had an early retirement due to heart attack. So they were living with very little money. She had entered psychiatric treatment for her depression for these 2 years, with no significant improvement. And then she was referred for psychological treatment, and we got in touch with her. That's her grid. Okay, let's try to understand it a little bit. So this is the people. Let's focus on the columns only at the moment. So we have self now, how Elena feels at the moment. We suggested to use self before something because she marks like the 2 years before she was in a different condition. So we want to understand how that different condition was different also in terms of her schemas and identity. So to do that, we had to put this element here, and then we have her fathers, her son, the stepson, and also the husband, brothers, sisters, friends, a non grata person, someone she doesn't like at all, also a stepdaughter, and the ideal self. The ideal self is very important. It's how she would like to be. So it's where she shows her values and goals. Okay, so for example, with this, she is saying that she is a little bossy. You remember the 3 is a little bossy. And for example, her sister, 11th, is very, very, very quiet. And his second sister, number 12, is very, very bossy, as well as her mother, right? So we can see how bossy quiet behaves in different people, how it's applied to different people, and also is telling that for her, the ideal self is to be a little quiet, but not too much quiet. Okay, so we are getting some meanings. We are seeing one of her schemas, and we are understanding how she applies that. That's interesting to look at her evolution before the fibromyalgia and now. And we can see, for example, that before she was seen as a hard worker, very much hard worker. So not just quiet or a little bit. No, she was very much a hard worker. And now is exactly the opposite, an slacker, right? So we can see the psychological impact in her identity of the fibromyalgia condition. No impact on being a good person. She saw herself as a good person before and now, okay? But a lot of impact here, a lot of impact in active, now she is uncaring, and also in the management of her emotions. For example, she sees herself now as something to get emotions out, but before that, she was keeping emotions inside, right? So you see, these are this is very, you are psychotherapists, you know that this is very relevant information, how the self has changed, how this condition has changed her view, how is she criticizing herself for being a slacker and caring because of the illness. You can see, you can smell a lot of self-criticism right from these ratings here that you could then later explore in the therapy session, right? So there is a lot of information. I'm just focusing on a little bit. So what we need are methods for analyzing this and getting most of the information from this data. Okay, the repertory grid is an assessment tool. It provides us with a lot of information, but at the same time, is an intervention tool, all in one. It's a transformative exploration. I mean, if your clients answer a questionnaire, I wonder how much they learn about themselves. But if they do answer a repertory grid, even in the questioning phase, even before that we show some of the results, it is a transformative process in terms that they can clarify many of the aspects. And so self-knowledge is a curative factor, which is used in many therapies. It's like we could consider it a common factor across many therapies, probably except behavior therapy, but maybe also in behavior therapy in an indirect way. Okay, so self-knowledge is crucial to psychoanalysis, CBT, I mean, everything. And self-knowledge, I propose an operative definition of self-knowledge as drawing a personal map with the schemas that we work with, and being the self-identity, the organizing principle of this map. Okay, so when I say self-knowledge, different people understand different things. I am clarifying my understanding now of this in a very specific way. And why is this so important? Because I assume, maybe you could disagree with me, but I assume that any meaningful change that we achieve in life or in psychotherapy implies some degree of identity reconstruction. We could discuss about that, but I will move forward, okay? And also a phenomenon that we see a lot in psychotherapy, which is ambivalence and resistance to change, has to do with our need to preserve our self of identity, our need for continuity. So I suggest right now to see psychotherapy as the dynamic interplay or the dialectics between the need for change and the need for continuity. Not just as an enterprise for change. Psychotherapy must be redefined as in these terms of taking care also of the need for continuity. Okay, why is not the repertory grid the most widely used instrument all over the psychology and psychotherapy world? Well, it has a lot of barriers. One of them is that you need training for the interview and for the analysis. You need to conduct data analysis with the matrix, so that data matrix can be analyzed in different ways. You need to know how to interpret that data analysis. You need usually time until now to enter that data into that you collected in a piece of paper, to enter it into a software, whatever software you used. to extract some data. And it was difficult to share the results with the client because this is quite a technical thing. And we could run into something I think is not a very good idea, is the danger of intellectualization of the therapy process. We need to avoid that at all rates. Okay, so we developed this instrument, EYME, Explore Your Meanings, which is an immersive digital platform to help therapists, not to substitute therapies like artificial intelligence, okay? I am not against it, but I am not trying to substitute therapists, but to assist, to help them in their endeavor in identifying values and conflicts in identity. It does the interview, so you don't need a lot of training. The software, the digital platform does the interview, is asking the questions for you. You can just be next to the patient, so you can be in this type of context, right? And have the conversation assisted by the computer, tablet, or a smartphone. And as EYME is making questions, asking for the perceptions on different elements of people, it extracts the key characteristics and values, and then does the rating task in a way, very important, that the respondent, the client, doesn't need to use the scale from 1 to 7, which can be confusing. Okay, so it does it in using the mouse and moving the mouse to one position, the people in one position or the other. So it's very visual. Okay, and then EYME presents a report with all the data analyzed and suggesting some identity indicators and some targets for intervention. And finally, with 3D and virtual reality technologies, the person can explore her meaning system as a map, either in a screen or like this, either in a screen like this, so that Elena could see her system, or going inside the map using virtual reality. We can have a look a little bit at this screen. This is like a photograph of the screen when you are inside the app. If we have time, we can do that, but I don't think we have much. But you can move the map to focus on one thing or the other, but you can see that here is the ideal self, and the self before was not so far away from the ideal self, but the self now is quite distant from the ideal self and getting close to the non grata person, who, by the way, was her ex-husband, who had mistreated her, okay? And was seen as uncaring, slacker, unhappy, stubborn, bad person. But she was becoming similar to him in some aspects. So that gives us an idea on how hard was for her current situation due to the fibromyalgia condition, right? So that could help us understand her depression, because she was now being pulled away from her previous position close to the ideal self. And now, for example, before that, she was open to dialogue. Now she is stubborn, similar to her husband. So that's terrible for her. No. So all these things can be explored here, and we can, and she can give you some insight about this. And for example, some of the problems she's having with her son, which is giving her some head pain, some pain. And now we can see why she has problems in her relationship with her son. She perceives her son as similar to her husband, absolutely similar, right? So she's relating to her son as she relates to her husband. And this is not like a clever psychoanalytic interpretation I'm making. It's just from the ratings. It's just from what she already told me, okay, but put in a different order and taking the extraction. So how did we arrive to this map? Okay, we were using this matrix, and we applied multivariate statistics to the matrix to create 3 axes, which is like 3 factors. This is the first one, this is the second one, and the vertical one is the third one, so that we could put in a 3-dimensional space every one of the points of the matrix, of all the constructs and all the construct poles and both poles and all the people in the grid, so that we have like a synthesis, a visual synthesis of all that data matrix. Okay, and the size of the balls, of the spheres, the size of the spheres represents the percentage of variance accounted by this particular element. So non grata is the element explaining the most of the variance. What does that mean psychologically? Because clients do ask that question often. Okay, it does mean that that person was very useful for defining her meaning system, because she has a very clear position in that system. She has everything she doesn't want. It's like a prototype of that is very important for aligning for the structure of their meaning system. Okay. Okay, maybe I pause for a minute and I leave if there are questions about understanding how the grid works and this representation.
Yeah, I
No
think I'm
question.
going to take the chance to ask you a question myself.
Okay.
This all sounds very exciting. I think I might be mistaken, but it sort of sounds like we're evaluating the consultant based on their own categories instead of running at them with our own theoretical models. We're not even speaking about anxiety or depression, just how the person is viewing themselves. And I find that very interesting. And I'm sort of wondering, it might be far-fetched, but if we could use a repertory grid in a routine outcome monitoring environment, if we could compare at how the person wishes to view themselves or what the ideal self, the past self, and how they change session to session. I mean, I'm not sure how stable or strong these relationships are and how much work they take to start breaking down, but wondering if that could be a possible use of these grids.
It is possible, but it is not practical or feasible, because one additional barrier that I did not mention is the time consuming. But the time consuming, I see it very, it's very profitable, because it could be with EYME, it's reduced, it could be about 45 minutes, right? But with these 45 minutes of assessment, you have hours of therapy, information that would cost you hours and hours and months of therapy to arrive to that point. So it is cost effective, but still it has a big cost in terms for including in a routine outcome assessment system. I don't see it viable. I love it, but I don't recommend it to you for that. But I do recommend it, and we are using it in the psychotherapy process at the beginning and at the end of the process to see the changes in identity, like a pre-post, but not pre-post after the end of therapy, the post-assessment, but considering it part of the last part of the intervention, right? So we do it. Now I will mention to you a project in we are using 16 sessions, and we use the repertory grid in the second session and in the 15th session to see, because then we can discuss with the client the results, and that discussion is in itself useful. So I forgot to tell, and sorry because other people want to talk, but I forgot to tell that this instrument will be is very well suited for what some authors in the SPR community term therapeutic assessment. So he's using the assessment for therapy. So there are some authors using that, and I think that fits very well in that context.
Thank you. Thank you very much.
Guillem, I have, this is Franz speaking. I have a question. Actually,
Okay.
maybe I should mention that to the others, you of course know that we have used WebRead to assess the complexity in the thinking of psychotherapists or candidates for psychotherapy training. But that's just one of the useful possibilities one has with WebRead. Unfortunately, we did not have EYME to be used in that research. I would have loved to do it in a probably more valid way with the EYME. But the question I have is a rather simple one. What about the possibility that the opposite pole of one item, like bossy, for example, would be different for one person than for another person in the environment of the patient? For example, for one person, she would say that the opposite of bossy is quiet, whereas for another person, she might say the opposite of bossy is giving or even fostering autonomy. So, you understand what I mean? That
Yes, absolutely, absolutely. Yeah.
one pole would be identical for different persons, and the other pole not. How would you handle that if it occurs?
Well, one of the things that we must be aware of is that the repertory grid is an very imperfect instrument. One of the reasons is very essential, is that the constructs are the grasping of differences.
Mm-hmm.
The two pair of adjectives are a way to represent a difference. Okay,
Mm-hmm.
it's like in this cup, is like the handle, the label. So bossy quiet is just the handle. The important thing is the construct. So bossy promoting autonomy would be a different construct.
I see.
With similar labels, but the labels are not the constructs, and we are working with labels, and this is a weak point of the repertory grid, because we cannot work with the constructs, because the constructs must be in the semantic memory.
Yes.
And some of them might be represented in terms of language in a way that could overlap in some labels with other constructs, but others might not even be possible to be expressed in labels. This is what Kelly termed the pre-verbal constructs, distinctions that have not been verbalized, and that they don't have any label for it, but they do operate in the system as much as the others, the ones which have labels. That might be a way of understanding the unconscious for Kelly, right? So that what you mentioned, Franz, could happen very easily, and now we would discover that there are two different constructs being used, and we need the person in the grid to use the same construct for all the elements. And then if we need to add a different construct, we could use bossy 2 dash for autonomy promoting, right? But
Yes.
it would be like a different construct to be added after to be able to capture those meanings which are important, of course.
Yeah. Maybe one would also find that maybe the equivalent of bossy, the opposite side of autonomy giving, is slightly different from just bossy.
Exactly.
Finding a more precise word for the difference of being autonomy furthering. Thank you.
Exactly.
Thank you, Guillem.
Thank you for the question. And I also, for reminding us of other types of analysis that I am not mentioning here. One of them is that we can look at the complexity of the data matrix, that reflecting the cognitive complexity of the person. And
Yeah.
that could be very useful, as Franz said, for looking at therapies, because therapies, they need to be quite complex in dealing with the experience of the clients, and not assimilating my client of 4 o'clock is the same as my client at 5 o'clock, right? Maybe it's a little bit different. If your system is not complex enough, you will see your client of 4 o'clock exactly the same as your client of 5 o'clock. And that's not a good thing for a therapist. So I think that the repertory written EYME could be used for the training of psychotherapists, and including seeing their systems, and also if they have a number of clients, looking at how they see their clients, or even looking with more detail to a specific client construct system as a way to generating more metacognitive and empathy to the client itself. So it could be used. Thank you, Franz, for reminding me of that.
Thank you, Guillem.
Miguel.
Hi, Guillem. Thank you very much for the presentation. I was wondering about two different things. The first one is if you consider the possibility, probably this will be too complex in terms of the technology, but I was wondering if it would be more immersive to have photographs of the people that are, but I don't know. Have you tried this? Because I was imagining that it's very different to have mother or to have a photograph of my
Yes.
mother.
Yeah, absolutely. Absolutely.
And the
Yes.
second question is, this gives you a map of the interpersonal world of the client. And I was wondering if it would be possible to enter other important representations from the perspective of the client. Imagine the world, the future, or other concepts that could be relevant for the kind of psychological suffering.
Well, the instrument is quite focused on the interpersonal world and also in the identity. So I don't think the future is so relevant, or at least the repertory could not capture it. But my future, it is. Myself in the future. This is important. So we are using now in our research me in 2 years, because now we are working with young people. So me in 5 years, self in 5 years is like a long time. Many of them are at the end of their studies. So me in 2 years is how they project themselves in the future after they finish their training. So we are using that. I mean, some of the things could be adapted. For example, if you have a client who had a migration experience or that had a traumatic experience, you could use the self, not the trauma, but how I was before the trauma and right after the trauma, or now, and see the impact on the self of that event or characteristic. So that could be done. And this is another of the characteristics of the repertory, that you can adapt it to the particular circumstances and history of your client. That's the reason we apply it at the second session, not as an assessment battery before the therapy, because we need to adapt it to the family characteristics, to the events, to the complaint of each client, which is different. And with respect to the pictures, it has a lot of pros and cons. For example, ethical issues. You need all the pictures of the people. You need permissions from all the pictures. That's a nightmare. But also, if I have a picture of my mother, it's very different when she was young and I was a baby, or if it is when she was very ill, seriously ill, just before dying, or if it was when I was 20 something, or now that I So the particular situation the photo was taken could also be influencing.
Makes sense.
So now we are working with something which is more abstract, but it fits well our purpose. But of course, it would be much more emotional. Of course, it would be. It would be.
Okay.
But still, this is quite emotional when you use the virtual reality.
I imagine that. Yeah, I have tried that with you before, so it's interesting. Thank you. Thank you.
Thank you, Miguel. Okay, is there any other comment, or should I continue? Okay, thanks. Okay, so now I will talk a little bit about identity conflicts, and we have to, the analysis of self, we need to distinguish between self-congruency and self-discrepancy, and we can do that by comparing two elements, self now and ideal now, and ideal self, sorry. So we have constructs in which self now and ideal self are close, and we can term them congruent, and there are constructs in which self now and ideal self are distant, and these are set apart, right? So, for example, we have in Elena's grid, we have these discrepant constructs. So this is how she sees herself now, and this is how she would like to be, right? And we have a criteria for identifying these constructs, which are provided in a written report, and it's four points of difference, and this reflects Elena's need for change. She needs to change from this to this. Okay, this is clear, and I think it's very interesting because sometimes when you have the first or the second interview with a client, of course you work with the goals of the client, what the client wants to change, and you work with that in the colloquium and in an narrative way. But when you put it into the grid, you might find aspects that she wants to change that she didn't mention about it. So, for example, she didn't mention she wanted to be more open to dialogue in her first session. And now we know that is a personal goal for her, right? She told us she wasn't very happy. She told us she was crumbling and she wanted to be stronger. She somehow let us see that she was perceiving herself as a slacker, and before that she was a hard worker, but she didn't mention about that, and we got it in the grid, right? Okay, so now we have to look at the congruent constructs, that is not very often made in the psychotherapy field, right? So what are the things in which Elena is satisfied with? She's seeing herself as generous, human, good person, good with money, not stingy, and getting emotions out. She's happy with that. She doesn't want to be selfish, nagging, bad person, stingy, keep emotions inside. These are assets. These are, if you like positive psychology, there it is. This is positive psychology provided by her. And these are constructs in which self now and ideal self are very close, or they got the same rating. So this is expressing the need for continuity. When she is doing things that are congruent to this, she is coherent. And the need for coherence is very important. Okay, so sometimes we have identity conflicts, what we call implicit dilemmas. So, for example, Elena sees herself as currently as crumbling, okay? And she wants to be strong. This is a discrepant construct. We saw that. And there is a correlation in the data matrix, a tendency that the people who crumbles is also generous. But the people who is strong, they are also selfish. And this is a congruent construct. She doesn't want to change in general. She doesn't want to be selfish at all, right? But these two things are connected. When I ask Galit, I ask how passive people are, and she mentioned that they, well, I need to look at it. Maybe you can help me, Galit.
Yeah, unmotivated.
They are unmotivated, exactly. So this is an association between constructs. So she's inferring that when someone is strong, is also selfish somehow. Okay, but that association is not particularly helpful for her, because if she gets good treatment that enables her to become more strong, or if she accumulates the courage to be strong, then she starts feeling her identity, feeling herself as selfish and looking only for her needs. and not looking for other people's needs. And then she feels uncomfortable and returns to gambling, because that is where safe base is. It's like our mind constructs stereotypes and prototypes. And here we have a prototype of the strong person who is also selfish. And maybe someone in her family was like that. Maybe her father was strong, but also selfish. And there is another prototype, which is crumbling, but being good person, being generous. And now changing in the symptomatic part implies an undesired change. So that is impeding or blocking the change process. And she's not aware of that. And we know it just because of the structure of the data. And so this is something to target in the psychotherapy process. Let me give you now this general idea that I propose psychotherapy as our constructivist systemic therapy that we are using is based on respecting, legitimating, and harmonizing both parts. The part that needs for change, signaled by the discrepant construct, stopping to be crumbling and becoming strong, which is it's needed for her personal evolution. It's pushed by the family cycle. It's the position that wants to get rid of the system. It's the common position in psychotherapy. Psychoeducation, prescription, exposure, many techniques are pushing the client towards change in that situation. But then we have the other part, which is the part that looks for continuity. She wants to continue to be generous and doesn't want to change to a selfish person. And this is recognized for systemic theories as the homeostasis, or in coherence therapy for the pro-symptom positions, the reasons why change is not desirable. And we, as a therapist, might need to embrace both aspects of the identity. We cannot, I don't think it's a good idea to only sit with the position that wants the change. I don't think that's a good idea. I don't think good therapists don't do that. The theories somehow support that position. They say that we are agents for change and we should be pushing change, but good therapists don't do that. They take into account both aspects. And I think that our theories should reflect that, and also our methods of assessment and our techniques. Okay, well, just let me show you a little bit of research of how important these internal conflicts detected using the repertory grid are in depression. We had like 2/3 of the sample having this type of conflicts. Also, we did several studies published in a meta-analysis with different populations. For example, clinical population in general, half of the sample had at least one implicit dilemma. In major depression, 2/3, dysthymia similar, bulimic patients, more than 2/3, fibromyalgia, more than 2/3, anxiety, half of the patients, social phobia, about 2/3, and somatization, about 2/3. And the non-clinical sample, they also have dilemmas, but the percentage of people having at least one dilemma is lower, right? So this is what our meta-analysis was providing. And we studied with the grid conditions such as psychosis, and we studied personal identity using the grid psychosis, and you can, there are several publications about that in well-recognized journals. And also we compare a sample of psychotic people with a diagnosis of psychosis, and people with a diagnosis of depression. And we found that self-discrepancies were higher in both samples than in controls. And in both samples, they were associated with depressive mood. Also, we found that interpersonal dichotomous thinking was more prevalent in women in both clinical groups. And this means using extreme scores in the grid, so using more extreme scores. And women with psychosis showed higher ideal others discrepancies. So they were more critical about the people in the grid and also had more complex structure of their personal identity than their male counterparts. That happened in psychosis and didn't happen in depression. These are some of the results. We found also more implicative dilemmas in patients with functional gastrointestinal disorders, also in adolescents having with different levels of depression, not clinically depressed adolescents, but a sample of adolescents with 2 different levels of depression. Also, we have already data on borderline personality disorder, and we found more presence of these conflicts with them. And we found that that conflict resolution during psychotherapy had an impact on the level of depression symptoms and psychological distress in a very rare journal that you might know, which is Psychotherapy Research. And here, so we develop a manual for working with depression, with dilemmas. And you can find that manual by free in BMC Psychiatry. This is like a 60-page manual on how to work with these dilemmas. So my recommendation is, if you have a client with a dilemma, you better focus a little bit on that dilemma. Otherwise, the therapy process might be blocked. We also wrote a book in Spanish for those who still like having a book, like an object. And we conducted several randomized clinical trials comparing standard CBT with dilemma-focused intervention. And they got similar results, or the differences were not statistically significant in terms of the differences, but they got a similar degree of efficacy than CBT for depression. And also we use it with women with fibromyalgia who had some depression symptoms as well, with similar results. This is the most recent clinical trial. And now that we have EYME, this was before EYME, now that we have EYME, which is transtheoretical, transdiagnostic, personalized, and it's based on our previous evidence, we conducted, and we have the possibility of having the person to explore the map using virtual reality. We did several other more recent trials with no results yet. This is finished, but we don't still have results. And we used 3 groups: CBT, personal construct therapy, and personal construct therapy, including virtual reality, with people, young people having mild and moderate depression. This is a very recent article, January 25, with a case report of this study, which is not yet, the data for the study is not yet published, but this is the report. And we created also a new treatment, which is called identity-based transdiagnostic therapy for young people to deal with these conflicts. And we are creating a manual, and we are testing the manual. We are finishing the pilot stage of this project, and we are beginning to recruit, and we are comparing this IBTT, identity-based transdiagnostic treatment, with the unified protocol of Barlow, with a randomized clinical trial, with several mental health professionals and centers, and we aim to recruit 138 patients, 16 to 29-year-olds with primary complaint of depression or anxiety, 16 sessions, and 1 hour weekly sessions. I forgot to put the 16, sorry. And we are using several instruments to assess these changes. Some of them are related to identity. I'm not showing them here. And this is another study with young people who don't have a diagnosis, trying to improve their metacognitive skills and self-awareness with 3 sessions. These are not clinical, I emphasize. And I wanted to mention the metacognitive measures we are using because we are finding changes in metacognition after using EYME and also in self-esteem. So, well, I could continue with this, but I probably should stop here and let people make questions because I was rather fast in these last parts. I have other things to mention. Maybe we could discuss the results if you want later, preliminary results of this study. But we can pause here for questions because we have about 7 minutes left, and let's see in the chat. Okay, Nicole said if we can see. Well, sorry, this was late. Okay, thank you, Miguel. Thank you. Okay, bye-bye, all those who have to leave. I don't know if there are questions or comments that you want to raise.
I have, if I may again, I have a question.
Yes, please.
Francis speaking. The approach is very different, but the consequence of the importance of exploring also what speaks against change in therapy reminds a little bit of motivational interviewing. And I wonder how you think about that approach. I'm aware that there are big differences, of course. I would not like to implicate that it's just about the same, not to be misunderstood.
Yes, I understand. Yeah, it's an excellent question. It's an important question for me. It has been for maybe the last 2 decades. It wasn't a question 2 decades ago because motivational interviewing was not incorporated, but it seems that finally the CBT approach was aware that they could not only talk of cognitive distortions and errors and irrational beliefs. They had to understand conflict as part of human experience, and they shouldn't be psychoanalysts just by doing that. They could do it in a different way. And thanks God, motivational interviewing came across and was used, and they begin to talk about ambivalence. This was not talked about in CBT before. And I think the approach are very similar. The aspect is that in a motivational interviewing approach, they have the idea that the change is the good thing, and that there might be positions in the client that are against change, and that we must respect that. Okay, and in that we agree, but our position maybe goes a step further, saying that the focus of therapy is not change in symptoms, but the person finding peace in her inner conflict, right? And so this is like the superordinate goal. And in that is different from the motivational interview. Because in the motivational interview, it's like the therapist is being kind to the patient and not criticizing the patient for the reasons for not changing, but not always considering those reasons as something very wise. Is considering that the client is mistaken, but respecting, is very respectful, right? But I don't think they go further than respect. They don't understand human nature as a dialectical tension. and life as something so complex that creates dilemmas for us all the time, and that our clients are not so different from us. We all face dilemmas, and sometimes we don't know how to handle those. And sometimes we become trapped on those. And so it's like problems of living seen from the point of view of dilemmas. I don't know if I'm answering that.
Yes, perfectly. I understand. Just as an essence, I understand you saying in motivational interviewing, the side which is against change is like an obstacle which needs to be overcome by acknowledging it, while you are more neutral and tried, as you said, to bring into peace and kind of integrate these opposite trends or positions, right?
Yes, yes. Thank you for the summary. Excellent.
Thank you.
More questions?
So this gives me a chance to congratulate you to this amazing amount of research activity which you have just very fast, but it's impressive anyway.
Thank you, Franz. I really appreciate that coming from you, especially. Yes, thank you. And well, I thank you your participation and your comments, and I really enjoyed being with you and your participation. A bit sorry for you, Galit. I maybe abused you a little bit. I'm sorry if I did. No?
Not at all. I enjoyed it very, very much. Thank you.
Okay. Okay. Thank you. Thank you. I don't feel guilty now.
Okay, thank you very much for a fascinating presentation, and thank you everyone for participating. I just want to remind everyone about our event this summer.
Thank you, Chris. Sorry.
No problem at all. I just want to remind everyone that the SPR conference is going to be both in person and virtual. So please, anyone who cannot participate in person, please join us online. And also keep an eye out for our social media for any future events. So thank you everyone very, very much.
Thank you. Bye-bye. Have a nice
Thank you very
evening.
much, Guillem.
Okay. I'll give my regards. Yes. Okay, Chris.
And thanks to the organizers to set up this.
Oh, yes, absolutely. Absolutely.
Thank you. Thank you,
Thank you.
friends.
Bye-bye.
Bye-bye, guys.